right, everyone. Good morning. Welcome to today's fiscal year 2024 to 25 cost and reimbursement comparison schedule check-in meeting number 2. Thank you all for being here today and for the important work that you do every day to support students across California. My name is Dana Ramos, and I am an analyst with the Local Educational Medi-Cal Billing Option Program, also known as LEA-BOP Policy and Fiscal Unit. The purpose of this check-in is to provide clarity on the Children and Youth Behavioral Health Initiative, also known as CYBHI Fee Schedule payments on the CRCS form, and instructions and answer questions that will assist local educational agencies, also known as LEAs, with completing and submitting their CRCS. For this check-in meeting, we're going to request that if you will be involved in CYBHI fee schedule payment reporting on the CRCS this year, that you include your LEA name or National Provider Identifier or NPI in the chat so that we can be sure that all LEAs with CYBHI payments are receiving the information presented today. If you are a billing vendor, please include at least one LEA name or NPI that you will assist in preparing the CRCS. If you are here just to listen and will not be involved in any CYBHI payment reporting this year, you do not need to include anything in the chat. At the end of today's meeting, we will reach out to LEAs that do not have any representation at today's check-in so that we can ensure that all LEAs with CYBHI fee schedule payments in fiscal year 2024 to 25 have this information. I would like to begin with introductions and acknowledging the rest of the LEA-BOP who is here today from the Department of Healthcare Services, also known as DHCS, and our consultants at Guidehouse. Thank you all for being here today and for your ongoing dedication to the program. If you have any questions during today's check-in, we will recommend you to hold on to them until the very end, as some of them may be answered in the following slides. DHCS will also be taking verbal questions at the very end, so you will have a chance to raise your hand after we go through the slides and you can ask your question during the live Q&A. If you would like to submit a question, please submit them in that chat. To utilize the chat, click on the chat icon on your tools bar, which you can see on the right graphic here. A chat window will open to the right side where you can type and submit your questions. If your questions are not addressed during today's check-in, please send your questions to the LEA inbox at lea@dhcs.ca.gov. We also have live captions available for anyone who may need them. The graphic on this slide highlights the steps to enable live captions with arrows pointing to each options and teams. To turn on captions, click the More icon in your Teams toolbar, select Language and Speech, and then choose Show Live Captions. Captions will appear in the bottom panel of the meeting. Today is the final check-in meeting that is planned for the fiscal year 2024 to 25 CRCS. Today's meeting content will be limited to reporting CYBHI payments on the fiscal year 2024 to 25 CRCS. There's no need to join this meeting if your LEA did not receive any CYBHI fee schedule program payments for services rendered in fiscal year 2024 to 25. However, if you feel the need to stay and would like to listen just for curiosity, please feel free to stay. If you do have general CRCS questions or think of a question after today's call, you can submit those to the LEA inbox and we will respond directly to your email. As far as resources go, the main CRCS webpage is found on the LEA-BOP website and contains the documents you need to complete the CRCS. This includes general information on the CRCS, including due dates, the submission window, links to CDE information such as indirect cost rates, and general CRCS resources. Once you are on the CRCS webpage, you will scroll down to the bottom of the page and you'll see the section titled CRCS Forms. Under that header, you will see a link to the fiscal year 2024-25 CRCS landing page. The fiscal year 2024 to 25 CRCS webpage is now live and includes the Excel template, instructions, and detailed supporting reports. At this time, the documents that are not posted to the fiscal year 2024 to 25 CRCS webpage are the Program Administration Withhold Report and the CYBHI Fee Schedule Program Payment Report. However, the reports were sent via e-blast on February 10, 2026, and will be posted to the website as soon as possible. Since the report was sent via e-blast, LEAs should have all the information needed to complete the CRCS by the due date of March 2nd, 2026. On December 18, 2025, we also provided a training on the fiscal year 2024 to 25 CRCS. The training slides and the training video have been posted to the LEA BOP website. To access the training video, go to the LEA BOP homepage, click the LEA BOP training link, and open the fiscal year 2025 to 26 training materials. DHCS hosted a general CRCS check-in meeting last week on February 4, 2026. Today's check-in meeting concludes the formal training on the fiscal year 2024 to 25 CRCS. However, if you have additional questions as you are completing the form, please email the LEA inbox. I will now pass it over to Mindy.
Thank you, Dana. Hello, everyone. My name is Mindy Vang, and I'm an analyst with the LEA BOP Policy and Fiscal Unit. Today, we are going to focus on CRCS reporting for LEAs that received CYBHI Fee Schedule Program payments for services rendered in fiscal year 2024 to 25. If your LEA did not receive any payments, feel free to listen in on today's material, but you simply ignore any columns that reference CYBHI Fee Schedule payments. However, if your LEA did receive payments for CYBHI services in fiscal year 2024 to 25, those will need to be recognized on the CRCS in certain instances that we will go through those requirements today. And so as previously mentioned, as far as resources go, the main CRCS webpage is found on the LEA BOP website and will contain the documents you need to complete the CRCS. And this includes general information on the CRCS, including due dates, the submission window, links to CDE information, such as the indirect cost rate and general CRCS resources. This year, there are 7 CRCS supporting reports published by DHCS. And as we mentioned a moment ago, the fiscal year 2024-25 CRCS webpage is now live, and the reports on this slide have all been sent out via e-blast on February 5th and also February 10th, 2026, and are available online. So the reports are 1, the annual reimbursement report, 2, the federal medical assistance percentage, also known as FMAP grouping, reimbursement percentages report, 3, direct medical service percentage, DMSP report, and 4, specialized medical transportation report. The reports on this slide, number 6, Program Administration Withhold Report, and 7, the Children and Youth Behavioral Health Initiative, CYBHI Fee Schedule Payment Report, were all sent via e-blast through the LEA BOP listserv yesterday. And so DHCS is in the final stages of posting these reports online. If you did not receive a copy of these reports via e-blast and is an LEA that needs this information to complete your CRCS, please email the LEA BOP inbox and we can forward to the e-blast from yesterday. And so today we will be discussing the CYBHI Fee Schedule Payment Report, which is new to fiscal year 2024-25. The CYBHI Fee Schedule Payment Report will provide LEAs with total CYBHI fee schedule payments made to each NPI so that you can determine what to include on the CRCS. First, let's start with a refresher on the fiscal year 2024-25 CRCS reporting related to the CYBHI Fee Schedule Program payments. This slide shows you what the new CRCS worksheet B.1 includes, and only the 8 practitioner types that are eligible to bill under both LEA BOP and the CYBHI fee schedule are captured. This worksheet is only for reporting CYBHI payments associated with LEA employed practitioners. Reporting is by practitioner type, so you will use the new CYBHI fee schedule payment report to determine the total CYBHI payments to input in the middle column of this slide, which is identified or represented by the orange rectangle box here. So for CYBHI payments that are attributable to a contractor, the fee schedule payments will be reported on Worksheet D. What you are seeing on this slide is a portion of Worksheet D. Payments can only be entered for practitioner types that are eligible under both the LEA BOP and the CYBHI Fee Schedule Program. So for example, lines 7 and 8 on the bottom of this slide, corresponding to licensed vocational nurses and trained healthcare aides, are blacked out here, so no payments can be entered. If the contractor received the CYBHI fee schedule payment directly for a service rendered, you would not include those payments on the CRCS. Now we are going to discuss the new CYBHI fee schedule payment report. The report contains data for approximately 40 LEAs that received payments for services rendered in fiscal year 2024 to 25. The report is organized by billing NPI and includes fields for the rendering practitioner NPI, the rendering practitioner type, and the total CYBHI payments. The data includes payments made by Carillon Behavioral Health as of January 9th, 2026, and excludes pending claims or claims in process as of January 9th, and also excludes denied claims. Because the CYBHI Fee Schedule Program is allowing claims for dates in the later part of fiscal year 2024 to 25, the data is not yet final. Because of this, the data that is posted on the supporting report is a draft and will be updated after claiming closes for the fiscal year. So any additional payments or claim corrections after January 9th will be accounted for in the final CYBHI payment report and will be used during the audit process. So some data anomalies have been identified and communicated to the CYBHI team for review. We are moving forward with publishing the draft payment data, but again, please note that this data is considered a draft at this point. Some of these are expected to be resolved in the final CYBHI payment data that will be pulled for CRCS auditing purposes. And we'll talk through each of these just in case they might impact your NPI's data. One, there are several cases where the rendering practitioner NPI is included on the claim, but the rendering practitioner type is blank. These payments have been included in the reports, but the LEA will need to determine which practitioner types was claimed so they know what practitioner type those payments relate to on the CRCS. The National Plan and Provider Enumeration System, also known as NPES, NPI registry, can be used to determine the rendering NPI's taxonomy in these cases. Secondly, there are 2 LEA that has a claim with no rendering practitioner information. The claim was paid but cannot be assigned to a specific rendering practitioner. And the best case for this scenario is that the billing LEA has this information, but if this is your NPI and you need help assigning this payment to the correct practitioner type, please feel free to reach out to the LEA inbox. And third, there are several cases where the billing NPI and rendering NPI are identical. These are assumed to be payments for affiliated providers and have not been included on the report. These records have been identified for the CYBHI team to review, and if they determine that the billing NPI should have been in the LEA, the data will be updated and the audit will take care of the situation. Fourth, there is one LEA that had payments under 3 different NPIs, one of which is the NPI used for LEA BOP billing. And so to ensure that all payments are reviewed for CRCS purposes, all CYBHI payments have been rolled up into the LEA BOP billing NPI. And fifth, there are several cases where the billing NPIs differ between the 2 programs. LEAs can set up different NPIs, so this is not an issue. But for the purpose of the CRCS, these LEAs payments will be reported under the LEA BOP NPI, since the NPI will be linked to the CRCS. LEAs will need to determine whether the CYBHI payments are applicable to include in the CRCS. And on the next slide, we'll include these LEAs so that you are aware of the situation if you are one of these LEAs. So here's a table of the 7 LEAs that are impacted by this issue for fiscal year 24-25. The CYBHI billing NPI is in column 1, and the LEA BOP billing NPI is in column 2, and the CYBHI type is in column 3. Again, this is not indicative of any problem with billing. It is just a way to ensure that DHCS is matching up the CYBHI Fee Schedule Program participants with the LEA BOP NPI that will submit a CRCS. So the top 3 records are enrolled in independent LEAs under the CYBHI Fee Schedule Program, meaning that they are not a part of a billing consortium. So because there is a one-to-one relationship, these LEAs will simply look up their LEA BOP billing NPI on the CYBHI payment report. And if the practitioners on the CYBHI payment report are also being reported on the CRCS, the payments will need to be included on the CRCS to offset the practitioner costs. There are also 4 consortia leads that will see payments on the CYBHI payment report under their LA-BOP billing NPI. And these will be a little more complex since the consortia lead will need to allocate the payments to the member LEAs. Again, the reason that these 7 LEAs are being crosswalked to their LA-BOP billing NPI is to ensure oversight that all CYBHI payments are accounted for on the CRCS, or there is a valid reason that they are not included on the CRCS. Consortia leads will want to have documentation of how you are allocating payments to the member LEAs and maintain that documentation for the auditors to support not only the lead LEA CRCS, but also any member LEA cost reports. So let's look at an example of the report. This is the layout of the report. First, you can see the LEA billing NPI on the first column, followed by the rendering practitioner NPI, the rendering practitioner type, and then the total payments for services rendered in fiscal year 2024-25. We'll now walk through these 4 examples. The top billing NPI with all ones received payments for 3 different rendering practitioners. These 3 practitioner types are all LA-BOP qualified practitioners. So this NPI will determine whether these individual practitioner costs will be included on the CRCS for fiscal year 24-25. If they are being reported on the CRCS, the LA will report the totals in the column at the right on worksheet B.1, assuming these are employed practitioners, and worksheet D if they are contracted practitioners. For the second NPI with all 2s, you can see that one of the data anomalies that we discussed earlier is present. The rendering practitioner type is blank for the rendering NPI ending in 224. In this case, this LEA will need to look up the rendering practitioner NPI and determine the rendering practitioner type. As a reminder, you can do this using your own records, or you can go to the NPPES NPI registry and input the NPI to see the name and associated taxonomy. Finally, the last 2 NPIs, all 3s and all 4s, have only been paid for 1 rendering practitioner. Because there is only 1 rendering practitioner, the LEA will identify this person and determine whether their costs will be reported on the CRCS. If yes, report the payment on the CRCS. If no, you do not need to include the payments. When you are not reporting CYBHI fee schedule payments on the CRCS, we recommend that you print the CYBHI fee schedule report and have documentation as to why payments were excluded from the CRCS. Documenting this now will help when it comes time for the audit. Since different groups within the LEA may handle the CYBHI fee schedule billing versus the LEA-BOP CRCS, it will be important to identify the contacts within the LEA that can answer questions if anything comes up when you are completing the CRCS or undergoing an audit. And so this concludes this section on the CYBHI fee schedule payment report. I hope you all found this information helpful. And if you have any questions about what we just went over, please put them in the chat or hold them until the end. Now I would like to pass it over to Dana to go over our next steps.
Thank you, Mindy. Before we close out the presentation, let's go over a few tips on reporting the CYBHI payments on the CRCS. So 1, let's only include payments when you are reporting the respective practitioner's cost on the CRCS. If the CYBHI rendering practitioner's costs are not on the CRCS, you do not need to include the CYBHI payments. Keep a record of all CYBHI payments that you are excluding and document the reason for exclusion. Consortia leads will be responsible for determining how payments were allocated to the member LEAs. Consortia leads should maintain documentation of this allocation in the audit file. Also, make sure that you identify employed practitioners versus contracted practitioners. There are 2 different places on the CRCS to report the CYBHI payments, depending upon whether the rendering practitioner was employed, which is in worksheet B.1, or contracted, which is in worksheet D. Finally, do not remove the CYBHI fee schedule payments from salaries when you are reporting salaries and benefits. Make sure you use worksheet B.1 so that the calculations are accurate. Also, do not report CYBHI payments as other health coverage on Worksheet A. There are specific places where CYBHI payments will be handled on the CRCS, so just ensure that you are either reporting on Worksheet B.1 or Worksheet D. The CRCS is due on March 2nd, 2026. Remember that extension requests must be sent prior to the due date, and the reason for extension should be noted on the request. Your extension should also identify how long of an extension that you are requesting. To wrap up today, we wanted to talk about the next steps in the CRCS submission process. After you've downloaded the CYBHI Fee Schedule Payments Report, you'll want to review the data for your NPI. If you see anything that needs discussing, please reach out as soon as possible to the LEA inbox. Once you have reviewed the data, your first step will be to determine whether costs are being reported on the CRCS for the rendering practitioners on the CYBHI payment report. If yes, you'll report the fee schedule payments on either Worksheet B.1 for employed practitioners or Worksheet D for contracted practitioners. Consortial leads will determine how the CYBHI payments are allocated to their members and will provide that information to the member LEAs. If your LEA will not report costs on the CRCS for the CYBHI rendering practitioners, you will not include any CYBHI payments on the CRCS. As a reminder, we suggest you keep a downloaded version of the report and the reason that you are excluding the CYBHI payments from the CRCS in your audit file. Finally, if your LEA closely tracks CYBHI payments and you'd like to include updated figures in your CRCS to represent payments to date, you may elect to use your own data to determine the amounts to input on the CRCS. If you select this option, you should keep a copy of your internal supporting documentation. However, there is no need to make updates to the data since DHCS will do a final payment reconciliation during the audit. Thank you for joining us today. We have some time for questions, so please enter those in the chat or raise your hand. It looks like Tim had a question on Worksheet A Summary tab, the withhold adjustment amount to be collected or refunded, row 65AE is not adding to or being deducted from the total overpayment, underpayment for LEA Bob services line on the certification tab. Is this intentional or in error? Thank you for your questions. Does anyone from DHCS or Guidehouse would like to jump in?
So I think it is an error, and so we are updating that. I believe the last maybe CRCS or two that we sent out via eBlast, it has been corrected. So that was brought up to our attention. The withhold for this fiscal year, 24-25 CRCS, it is separate from the overpayment, underpayment. So any withhold that is entered into that cell will not impact the overpayment, underpayment cell.
Tua, can I just add on to what you said?
Yeah.
So the form itself is fine. What the difference is this year is last year we incorporated the withhold into that overpayment, underpayment. And as Tua just mentioned, they're separate this year. And it's really more of a logistics issue behind the scenes for how the payments are processed using different RAD codes. So those two amounts will interact with each other for the LEA and the final payment, but they are separated out to begin with to create more transparency with essentially how the RAD codes will look on your remittance advice. Hopefully that helps.
Jennifer, I see your hand. I'll go ahead and unmute you.
Dina, while Jennifer is waiting to unmute herself, it looks like we have a couple of questions in regards to the MPI in the chat. So it's up to the LEA to decide if they want to use one MPI for both programs or if they want to use two. With that DHCS can't tell you which one is better. So that's something you'll need to decide internally and then make sure you are coordinating that, especially if the LEA BOP coordinator is not the same as a CYBHI coordinator. So you'll want to make sure that you're communicating amongst each other just to make sure you're also doing your internal tracking outside of the report that DHCS is providing with the CYBHI payments. I think that addressed the MPI questions. It'll be good to know what the pros and cons of using different MPIs. My biggest recommendation would be talk to other LEAs to see how they're doing it. The one thing that, again, DHCS can't tell you how to structure it within your own LEA. I think the one thing would be tracking internally in regards to getting CYBHI payments, LEA BOP payments, and if you think that it is worth going that direction of having 2 different MPIs. So again, that's really up to you and how you want to manage your tracking, and then keeping in mind how you're going to reconcile that when you're doing your cost report and the report that DHCS will be providing.
Thank you, Sarah. I'm not sure if it was answered already, but Samantha also asked, will DHCS notify CYBHI members of these requirements so they are aware? So we've been sending out e-blasts specifically to those who are participating in LEA BOP and CYBHI. So you should be getting those information as well. Okay, if questions come up as you are completing your report, please reach out to the LEA BOP inbox at lea@dhcs.ca.gov. Thank you, everyone.